When I was at university, I lived in a residential college. That time was the heyday of some iconic sporting stars. You might have wanted to bend it like Beckham, maybe spin it like Warney, or fly like Jordan. There was another less known simile at my college: to sweat like guano. Just to explain a little, guano in that sense wasn't referring to bat poop, but instead it was in fact a nickname of a person who lived at the college. And that person was me. To sweat like guano meant to sweat a lot, like David did. It was meant in moderately good humour, but highlighted the fact that as long as I can remember, I've always tended to leak more than even Washington's reflecting pool. Please don't paint me, though. Hi, welcome to the podcast, Where Are We At With? It's taking a look at pretty much every topic, one at a time. I'm David Curnow, aka Sweatman. If you remember our Where Are We At With Sweat episode, everybody does it, but at different rates. Some are barely noticeable, others should come with a permanent flood warning over their levels of moisture.
Moisture is the essence of wetness, and wetness is the essence of beauty.
Yeah, okay, no one likes the word moist. But it's not just a minor inconvenience for some people. Imagine packing several sets of clothes when you go to work each day because you'll need to change into dry ones every few hours. Or having constant problems with skin infections or fungal outbreaks. Or not being able to hold a loved one's hand because of how wet yours is. It may not seem like that much of a problem, but anyone with hyperhidrosis knows that it can be debilitating. Professor Neil Simon is the co-founder and managing director of Sweat Clinics Australia. He also happens to be the head of neurology at Sydney's Northern Beaches Hospital, as well as the managing director and principal neurologist at Northern Beaches Neurology. Yes, he's a busy man, but don't sweat. He's here to tell us, where are we at with hyperhidrosis? Neil Simon, thank you so much for joining us today.
Pleasure. Thanks for having me.
We're talking about something which affects our skin. At least in our minds, we think about sweating as being something that affects our skin. Why then are we speaking to somebody today who is, let's be honest, an internationally renowned neurologist, not dermatologist?
Well, good question, because the brain controls everything essentially. No, but hyperhidrosis, this condition is primarily a neurological phenomenon. And that is because sweat glands that produce the sweat are controlled by nerves, which are in turn controlled by the brain. And when you sweat too much, it's because the nerves to those glands are overactive, excitable, which causes them to emit more sweat. So that's why neurologists are involved, because we deal with nerve problems and overactive nerve problems. And also we use some of the treatments. We're familiar with the treatments that are used for overactive nerve problems, which also happen to help with excessive sweating.
We'll get on to what is hyperhidrosis in a minute. But first, again, along those lines, we mentioned neurology. Some of your research is in some pretty serious issues. We've got motor neurone disease, things like carpal tunnel syndrome, some stuff that really can be detrimental and damaging for people right around the world. Is sweating a bit of a step down?
Well, so motor neuron disease, obviously in the news, a really significant condition, devastating condition. And I think that we'd all accept that that's a terrible problem. And, that's a very heavy part of my job. At the same time, people with excessive sweating suffer a lot with it, in a different way and to a different degree, but it's something that's not trivial. It's something that causes a lot of problems for patients and who have it, for sufferers. So yeah, I consider it as an important condition. For me, it's like I enjoy working in that space. I do it, so it's sort of somewhat of a cognitive break, because I don't have to think about very complex neurological wiring and very distressing degenerative illnesses, which often neurologists have to deal with. But at the same time, it's quite rewarding because it gives these people who are suffering a treatment option, which makes them feel amazingly better, and then turns around their life. And that's nice to reflect in that, the sort of the happiness that comes back when they follow up with.
Like a medical florist in a way, bringing joy to people as you deliver what you deliver. We'll get on to some of those treatments in a moment. Let's then talk about what I mentioned. What is hyperhidrosis? How do we define it? And I suppose diagnosis.
So we all know that sweating is normal. It's a normal part of life. But what then constitutes normal and abnormal sweating relates to that person's experience. So excess sweating. So normal sweating is, I need a bit of sweat to cool down. We have other functions of sweat. So it's not just a temperature regulation thing, but from a normal perspective, there's an amount of sweat that you need depending on the context. But then when you are not in those contexts, or perhaps you're in those contexts, but your sweat levels are much greater than everyone else's, then that would move into abnormal amounts of sweating. And hyperhidrosis is essentially when you sweat more than you need for normal day-to-day life, and that it causes you symptoms and suffering because of that. So that's when it becomes a condition, is when the person who's sweating is like, oh, this is causing me physical or psychological symptoms as a result. I mentioned normal and abnormal, and I probably shouldn't use those terms because sweating is still a physiological phenomenon. It's not sort of a disease per se. It's just that the drive for those to those sweat glands is heightened, and so you're getting more of that physiological phenomenon that you need. So that's like hyperphysiological rather than abnormal. I don't necessarily like the term abnormal.
Given the range of given the range of human beings, that there is quite a range. In a sense, sticking with the florist concept, in a sense, is it a bit like gardening, where if I've got a tomato plant coming up in my marigold bed, it's a weed. But if the marigolds are coming up in the tomato bed, they're weeds. But vice versa, then they're not. It's a bit like that.
Yeah, exactly. So people with hyperhidrosis, they're still normal people having normal experiences, but their physiological process is just inappropriate for the context, inappropriate for the garden bed. The marigolds in tomato garden beds are good, I believe. It helps keep some sort of bug away. But
okay, so yeah, I chose just about the worst example there. Marigolds protect tomatoes from all sorts of pests.
So once your tomato plant is already in the ground, you'll want to plant the marigolds around it as a kind of barrier.
You get what I was meaning though, right?
that's okay. But yeah, 100%. It's like having a bit of a rogue pumpkin vine or something. It happens. But everyone loves a pumpkin vine, but when it's in the wrong spot, it's not what you want.
Botanics have also been corrected here. Let's stick to more scientific things. One of the descriptions I read about when we researched this was effectively that, in a sense, at times it's like your sweat glands are stuck in the on position. Is it a bit like that? Is that how we think of it?
Yes. So your sweat glands, you're right. Sweat glands can be in sort of the off position where there's inactive and not really emitting the sweat. And then the neurological signals come in and they sweat. Now, neurological signals are driven by the brain and the nerves, and they respond to environmental conditions to say, oh, it's hot now. We need some sweat to cool down, or I'm nervous. My sympathetic system's activated. Part of that system is this fright, flight, fight response, and part of that is to get ready to do something vigorous. Like when you're about to run off, the body's like, oh, maybe I should cool myself down in advance of that, and because I don't want to be wasting time thinking about it when I'm trying to escape the saber-toothed tiger. So that's then the sweat glands get turned on. They start emitting sweat, and then switch gets turned off when they're not needed. In hyperhidrosis, that switch isn't really regulated to the environment, and it's sort of on either all the time. So it's continuous, usually in the wakeful hours, not usually overnight when you're asleep, which is interesting. But it can also be intermittent. It doesn't have to be like permanent sun up to sun down or eyes open to eyes closed. It can be that you have it some days and not other days, or some parts of the day, not other parts of the day. But it's when you do have it, it exceeds what the environmental situation or whatever is.
It's interesting you mentioned there the idea of, I suppose, thinking about it, the idea of the body or the brain making that decision based on inputs and what it sees or hears or feels around it. But as you said, it's not something we're thinking about. We're not choosing our brain. We're not making our brain do this. It's all happening under the hood, as it were. It makes it a bit hard, I suppose, to understand what's going on there.
Well, a really fascinating phenomenon, which I've sort of been really curious about, is some people, particularly people with excess sweating of their hands, but it can happen in other areas as well. Probably the face as well is another common sight. They will often report or say that when they think about, they're not sweating, but they think about sweating and then they start sweating. So there's like a cognitive trigger to it, which is not sort of different to what you'd think. And we already talked about the environment and whatever else, but that's nowhere near the areas that might be responsible for heat regulation. That's a pure cognitive sort of psychic phenomenon that you think about something and then it happens. And that's, I find that quite curious. And I guess it speaks to interplay with, I'd mentioned already that fight, fright, flight, it speaks to the interplay between the sort of mind, memory, emotional areas, which are all interlinked. And then the autonomic areas, which autonomic is this part of the brain and the nervous system that supplies things like sweat glands, blood vessels, that sort of thing. So they're all closely interlinked. And that, I guess, phenomenon sort of speaks to that. And it also speaks to why people with hyperhidrosis often, there can be an aggravation in emotional situations, like their sweat gets worse in emotional situations or when they're busy, or, that sort of ties in with that sort of.
I think I think
Also,
even if you're not somebody who experiences this condition, I think we've all experienced the concept of thinking of something often involuntarily. Perhaps you just remembered something incredibly embarrassing and you're not deciding to remember it or deciding to react the way that you do in that cringe moment of shrinking horror because of what happened, or your body, effectively your brain's taking over and making these reactions before you're even ready for them.
yeah, it's subconscious. It's not deliberate, is it? You can't control your sweat. You can't tell your sweat glands not to sweat. It's not something that you could have mental control over. But interestingly, you can think about it and it makes them turn on by themselves. So
Okay, there's a whole new field to explore there. Let's step back a bit to these basics though, because you mentioned the idea of sweating on the hands or the face. So let's clarify here. We heard in our recent sweat episode that there are mainly two different types of glands. Basically one that's more watery, one that's smellier and more oily. Are they both affected?
they are both affected. So the the in hyperhidrosis, in both. So the apocrine glands in the groin and the underarms are they're common sites for people to have excess sweating. And then the eccrine glands in other parts of the body, including they're the things that make all the fluid, the watery sweat. And, maybe you could say that it's primarily the ecrine's watery sweat that happens in primary hyperhidrosis. But everyone knows about stress sweat, where you get sort of like, get nervous, you get that sort of different, like smelly sweat, it sort of smells different. And so it's like stress sweat. That's probably more the apocrine sweat. But yeah, I think that both of those glands can be affected. And it's sort of interesting that they've got somewhat different nervous supply, and that the nerves supply have different chemical signals in them. But yeah, both can be affected.
And locations on the body. We mentioned the fact that there are different glands in different places. Are there more common areas that this is an issue? Or as you mentioned, given that it's partly about when it's a problem, both physically and emotionally, is it about areas that are more public facing, I suppose? Tell us about the areas that are more prone to excess sweat than others.
Yeah, so it varies per person. The sort of the common areas that a lot of people report, underarms, very common. The forehead, in the face, it's often the forehead, across the nose, upper lip are common. This part of the face, less common. Scalp is super common, usually the front bit and the back bit, so like the band, not as much on the top, but you can have it all over. It's sort of kind of curious that there's selective involvement of these areas. Thighs, behind the knees, back, chest, obviously. I've got one patient, it was really fascinating. He had underarm hyperhidrosis. I can't remember where else, but he had one little area on his chest, literally a several millimeter circle where it's just sweated out, like a drip, like a tap of sweat coming out. There's one spot in his chest. It was totally bizarre. That it was just that the rest of the chest was dry, but just one spot.
So
You could see it just
I'm
beating.
struggling to understand the science of this. So effectively, the brain is sending signals along the various pathways, and it is sending it inappropriately just along some.
Yeah. Right, exactly. So that's a good point. Yeah. Why is it that those particular areas are more commonly affected? It's probably to do with networks in the brain, because things in the brain are sort of networked together. So maybe that's an efficiency thing. So you can have one set of signals that happen and do a collective job, rather than having to turn on 10 billion switches. You can turn on one switch that affects 10 billion areas, But yeah, those sort of sites tend to cluster together. I didn't say hands and feet, which is their super common areas. So, but you can have people in the same family, and one person in the family has really bad underarms sweating them, and the other person has bad hands and feet. And, so there's genetic factors, but the way it expresses in the person and way their neurological system expresses it varies. But yeah, I don't understand how the person had that singular point in the chest and how that would work from a network perspective. But it was very distinct. So there's a few mysteries for me anyway.
Imagining going behind the scenes at like a big data center or something with lots and lots of wires that are all coiled up together. Someone's been very careful about joining them together, and there's one wire that just happens to be touching another one where there's a thin section of rubber and it's just getting that signal and sending it out the wrong way.
Short circuit. Yeah, it could be that. It could be that.
It's hard enough when it's in your car, let alone in your body.
Exactly.
Okay, you mentioned the idea of in the family. Do we think it is genetically based?
It's very commonly associated with family history. At least half of people who experience it would have another family member with the same experience or the same condition at least. Maybe their experience of it's different. But so there are clearly some genetic contributions or susceptibilities, but you can have families, well, like a lot of genetic conditions where some are affected and others aren't. And certainly we see people who are the only person that they know of. Now, of course, there may be other family members who have it and it doesn't flag as a problem because they're like, maybe they work outside and they don't care if they're a bit sweaty. And it doesn't mean anything to them, like they're not a bit, but maybe they're very sweaty, but they're working outside and it's sort of normalized in their industry and it doesn't really affect their job role. And so they just go, oh, I'm just a sweaty guy, versus someone where it affects them a lot. So perhaps that is a bit of family history is missed for the sufferer because they don't talk about it, So
Obviously, professionally, it makes a big difference if you are a professional athlete, for instance, or a dentist, the amount of liquid coming off you into a patient's mouth or whatever is certainly a difference as opposed to somebody who's at training all day. So that's all that matters. Interesting, and because of course we did hear in our sweat episode that sweating itself is genetically linked in that you are more likely to produce the same amount as family members, and that does travel there. So obviously there is part of that. It's not something, as you said, it's not a disease. This is not something you can catch or develop as such.
You can't catch it. It's not contagious. You can develop it. In fact, it usually develops in adolescence or early adulthood, but it doesn't always develop. I've certainly seen people who develop the first symptoms later on in their life, like in their middle years, for example. So it's something that can develop, like as in it may not manifest earlier on, but maybe manifest later. And presumably with adolescence, it relates to hormonal changes, driving, contributing to sweating. And perhaps that's relevant for people who develop.
Yeah.
It's part of your makeup already. It's just how it manifests or how it comes out.
Obviously, puberty makes sense. That's when our body begins to be able to thermoregulate more appropriately. Therefore, that's when our sweating is going to be first noticed as to whether it's a problem versus kind of normal. But again, you talk about how our body changes during life. And yes, things like hormones, not just something like a perimenopause, menopause, but also all sorts of other changes for both men and women. It can manifest later. Does that effectively mean that those are the two main times, adolescence and then perhaps middle age?
So interestingly, so like primary hyperhidrosis, most people manifest before 25, so there's only a small proportion of people who manifest later. So yeah, the vast majority of people would manifest in young adolescence. Interestingly, that's people who, for example, primarily axillary underarm hyperhidrosis, experience people with hands and feet hyperhidrosis. They often have it present from a younger age, so childhood, like early childhood, which is curious as well, because that speaks more to a primary neurological nerve overactivity thing rather than that hormonal influence. So that seems to be, for me and in my experience, that seems to be quite a distinct separation, that underarm hyperhidrosis there's some sort of hormonal trigger to initiate it, whereas the other is, I think that's more primarily nerve network, starts earlier, more tricky to deal with, that sort of thing. So
yeah,
that's quite fascinating.
That really is interesting. And you mentioned a couple of times this, and I should have asked you earlier. You mentioned primary hyperhidrosis. What different types are there?
Yeah. So primary and secondary, keeping it easy. Primary means that it's just intrinsic to the body, that's intrinsic to the person. That is, it's the wiring that I've mentioned before. Secondary is some other condition that drives sweating. So for example, if you have infection, you've got fever as an infection, then your body gets hot and you sweat. You have, sweats as part of a fever. So if you've got some chronic inflammatory disorder, you might have excess sweating. You might have a disorder of the thyroid gland, for example, which drives metabolism, which drives the fight response that then drives the sweating as well. There are a variety of different conditions that can be associated with excess or increased sweating levels, but it's not caused by the makeup of the person. It's caused by the disease or disorder creating the conditions where you might sweat. That's
And
secondary.
for somebody who's walking into a clinic, Sweat Clinics Australia, for instance, hypothetically, just to name one of them that we have heard of recently, how do you determine that? How do you go about working out, look, this is primary hyperhidrosis, or we feel this may be a symptom of another issue?
Yeah, for sure. So if you have someone who presents with a classic history, let's say they're 25, they've had hyperhidrosis since they hit puberty, it's in those typical areas, their general health is good, they don't have any symptoms of any other condition, then it's very likely to be primary. As a routine for a new patient, I would get some screening blood tests to look for the various causes that might slide under the radar. It's probably low yield, but again, I wouldn't want to miss a thyroid disorder, for example, because they can be chronic and be present for some years before they're detected. So yeah, I'd just do a blood screen, but assuming the blood screen's negative, then we can be quite confident that it's primary. If I've got someone presenting later in life, for example, or the nature of the sweating is a bit different, for example, it's overnight, like night sweats when you wake up in sweat, would be mostly atypical for primary hyperhidrosis, then I'd be looking a bit more intently for an alternative cause. So that will change my diagnostic approach. So you'd be a bit more of an investigative, you take a bit more of an intensive investigative pathway.
And if it is a secondary a symptom of something else, do those conditions themselves normally present other symptoms in addition to excess sweat?
They would normally, yes. So, thyroid disorders present with additional symptoms. You can have, so if someone just presented with night sweats, for example, that would make you concerned that it's not primary hyperhidrosis, and you don't necessarily have to have other symptoms if you've got like a grumbly infection somewhere or cancer or something somewhere, we certainly see people presenting where they seem mostly okay, but maybe they present with night sweats or a bit of weight loss or loss of appetite, but they've got something significant going on. So you do have to have a fairly good radar for that sort of thing, so you don't miss an important condition.
Do we have any idea what sort of percentage of the population might experience this? And obviously that's couched in the terms of, as we said with the weed definition, it's hyperhidrosis if it's a problem, therefore it's not super easy to measure. Do we know what sort of numbers there are though?
Yeah, I think it's usually around sort of like 3 to 5% of the population. So quite a lot of people.
A lot.
And yeah, exactly. And that probably wouldn't capture those people who maybe, if there was like an arbiter of sweating, like, oh, that's too much, that's not enough. There'd probably be people in the 95% who you could say, oh no, you're sweating more than you should. But based on the definition of the experience of the person, 3 to 5% on surveys. So a lot of people in Australia, for example, have hyperhidrosis.
That's immediately 3 to 5% of Australians. That's hundreds of thousands right there that we can think of. It's certainly quite a lot. Just quickly, 3 to 5% of Australians means about 800,000 to 1.4 million. That's a lot. You mentioned some people may be excess sweaters and not be a problem. Some people maybe not sweat as much, but it is a problem to them in their particular circumstances. Professor Neil Simon is our guest. He's also a doctor, don't worry. He's the head of neurology at Northern Beaches Hospital in Sydney. He's also the founder and managing director of Sweat Clinics Australia, where the rubber hits the road, so to speak, or checking in on your sweat. We've mentioned the idea of the fact that this is effectively a neurological issue where signals are being sent in a way they probably wouldn't normally. Can that then be reversed and the brain not send the signals? Is there such a thing as the opposite of hyperhidrosis, not sweating?
Yeah, anhydrosis. So there's a condition called anhydrosis where you don't sweat, or hypohidrosis where you don't sweat enough. That's a bit of a mixed bag of conditions that cause that. It can be like there are brain conditions if the things that drive that thermoregulatory response aren't working properly. So there are some degenerative disorders like neurological degenerative dementia type disorders where that area of the brain doesn't work properly. There are some nerve disorders where the nerves that supply the sweat glands don't work properly. There are some genetic disorders where the sweat glands aren't created properly. And then it can be it can be a phenomenon related to medication side effects and other things like that, where that's where the signals are getting blocked, for example, to the sweat gland. So yeah, the opposite of hyperhidrosis is definitely a thing. The experience of the person, it can be significant as well, because you don't get that temperature regulation, so you can then be susceptible to hyperthermia, overheating. So that's definitely something that can be.
And I guess in the old days, they wouldn't have been able to chase down the antelope or run away from the creature because they weren't able to sweat enough and they effectively overheated. These days, you could possibly spray yourself in the face with something and get away with it. But it is a similar issue. You mentioned the fact that night sweats tend to be less of a primary hyperhidrosis issue. Are there other times that do they come out of nowhere like a migraine or a One Nation political success, just blindsiding you with the craziness of it?
So, well, so the commonest situation is that it's mostly during the day, mostly when people are awake. You can have it in the evening when you're awake, but once you go to bed, it usually stops. But the context when people notice it the most would be, it's very common we experience it in the workplace, because you're like switched on and your brain switched on, your body switched on, your nerves are like more active. Maybe you've got to give meetings, you're a bit nervous about that. So that sort of is an additional driver to it, and certainly can be a problem. We all know about exercise causing sweating, but interestingly, my patients don't tend to focus on exercise, because they're like, oh, well, I sweat, but in the gym, but it doesn't really matter because you're allowed to. But it's more in the other context, socially, that's a big problem, and the workplace, and that's probably where that impairment comes from. That their social life is hampered, they're embarrassed, they're body checking all the time. In the workplace, even though they're not feeling particularly nervous in their meeting, but they think that everyone thinks they're nervous because they've got big sweat patches on their arms, and it makes them lose confidence in their performance. So
Society does judge sweat a bit. We do, don't we? Subconsciously, even if we're not thinking about it, we do tend to look at sweating as a bit of a negative.
I think so. Yeah, it's got connotations, of anxiety, nervousness, weakness, I suppose, if you extend that, and that's probably where that's why people are. Besides the discomfort, and which is another important point, but I think that's a lot. That's a lot of where the sort of psychological impacts of it come from. That people, sort of lose their self-esteem and are embarrassed and self-conscious about that phenomenon.
That is obviously not a condition that can be treated with, say, medicine or surgery. That's very much a mental, a cognitive challenge. Can psychology play a role in the way that this is treated?
Certainly, if you have, like, let's just say you had you had the psychological manifestations sort of took a life of their own, then yes, 100%. We know that psychological management of medical conditions is important, because medical condition has a spin-off impact on mental health, and you've got to manage mental health if that's impacted. Luckily, with this condition, if you fix the condition, then everyone's feels great. So if you can sort them out for the condition, then generally their well-being improves substantially. And it just depends on then how, as I said, the other mental health facets, whether they need independent. My experience, again, it's managing patients, is that if you get on control of their sweating, their quality of life improves substantially.
Yeah, you mentioned there the idea of a little bit earlier about saying, "Oh, just don't sweat," or stop thinking about it, or stop making yourself sweat. Are there methods that people use to mitigate, I suppose? Better breathing clothes, cold shower, can they affect it, or does hyperhidrosis short circuit that and bypass those usual methods?
The people I'm dealing with, probably that's insufficient for them, because I'm sort of dealing with the pointy end of the spectrum.
Yeah.
But yeah, absolutely. Like, excessive sweating can be managed by stress management techniques. So that, which we talked about the psychologist before, if that's an issue, a psychologist might be able to help with various types of various methods to manage stress. Types of clothing certainly can help. So like breathable, natural fabrics, not avoiding certain styles of clothing. In fact, it's very common that people complain that they can't wear the clothes that they want. And so you can change your clothing, your wardrobe choices, to minimize the impact that sweating has. I guess that those sort of non-medical treatments are definitely relevant. But yeah, as I said, from my perspective, mostly people have tried that, it hasn't been sufficient. Another really interesting fact, which I probably could have brought up before, but people often find that it's the people with primary hyperhidrosis, often cold weather is bad. You need to think, oh, cold weather should be good because you're not, it's all about hot weather and getting warm and sweating too much. But very often the sweating is significant or even worse in cold weather. And that's probably again, because colder weather, you're sort of like a bit, everyone knows, you're a bit shivery, you're a bit, these sort of sympathetic nerves, the autonomic nervous system's a bit more upregulated. And so, yeah, that can drive sweat, even though you think I'll be fine in winter. These people aren't fine in winter. They're just as bad in winter.
I think everyone's probably experienced at some point the feeling of a drip of sweat coming down the middle of your back or something, and feeling it perhaps in a cool time when you maybe exercised or did something and feeling that it was inappropriate. I can imagine that having that cold drip of sweat when you are already cold, your body, brain, be highly attuned to that sensation and blasting out sirens and in a sense self-sustaining the process.
Yeah, totally. Yeah, that's a good point. So you go like, what's going on? And then your brain's more aroused and then it drives it further. But yeah, and then it's obviously very uncomfortable when you're cold and wet, and that sort of just compounds the situation. So yeah, that's definitely another context, I suppose.
Yeah. Okay, let's talk intervention then, because that is effectively the crux of what you're doing, particularly at these sweat clinics. What is the process? This isn't a case of take these 2 tablets and you'll be fine for the rest of your life. What are you doing?
Yeah. So look, it's good to understand, and I'm glad we talked about it. It's good to understand what happens and what causes sweating, because then you can understand how you might be able to fix it up. So you've got your sweat gland. It's got the gland under the skin and then a hole out to the skin where the fluid comes out, and then the nerve connected. And so you can basically approach it in all of those 3 locations. So you've got the hole coming out. You can say, okay, why don't we just put a plug in the hole? And so you can do that. You can put deodorant, like aluminium-based deodorant. The aluminium goes into the holes and blocks it. That's it.
That's what antiperspirants are, basically.
So yeah, antiperspirants block the sweat gland punctum, block the holes, so sort of sweat gets stuck there. And so that's the first option. In fact, that's the standard option. Everyone does that anyway. Before most people don't talk to the doctor about that. But there are different strengths of antiperspirant, different strengths of aluminium chloride that you can use to if the basic version isn't working. The higher you go, the more caustic they are on your skins, the less easy they are to tolerate. But yeah, that would be the first approach, because it's mostly benign. It's not invasive. It's mostly benign. You've then got, I'll jump over the sweat gland for now. I'll come back to that. Then you've got nerve signaling. So you can say, okay, we know what nerves or sweat glands. We know what the chemicals that they use to control sweat glands. So why don't we can block those nerve signals. So, and you can block it by taking a tablet that blocks it, or there's some newer treatments there's some treatments that are coming onto market where you wipe on the chemical that blocks the nerve signal. And that sort of diminishes nerve signaling. So then the drive for the sweating is less. And you can, but then you've got potential for side effects related to the chemical, because those signals that go to the sweat gland also go to other areas of the body. And so, if you're not sweating, then you're not got tears or not got saliva. And so, if you've got, this is for tablets especially, if you've got dry sweat, then you have dry eyes and dry mouth. So that's like, and there are some other things as well, but there are some drawbacks associated with it. But that's another approach. And we use that sometimes in particular where it's all over the body, because these topical treatments, you can't lather your whole body with antiperspirant.
Ultra strength aluminium chloride or something like that. You can't take a bath in it.
But and you wouldn't want to, because we've talked about thermoregulation. If you blocked every single pore in your body, then no sweat's going to get out, and then you're going to be hypo or anhydrosis. So if you take a medication, it might drop it down by 20 or 30%, enough to make it sort of manageable, but still not obliterate the function, essentially. And then you can, so an alternative to the tablets, like a chemical blocking of those nerves, is to actually disconnect the nerve from the gland. And the way we do that is with a botulinum toxin, which people have heard of. Probably most people have heard of it from a cosmetic perspective, and Botox. And it is something that disconnects the nerve from the gland. The nerve ending retracts, and then the chemical goes, and then over time, over months, the nerve grows back and then reconnects that gland, and then it starts again. And an interesting side fact on botulinum toxin, because everyone only thinks about it with terms of wrinkles, but that's actually fairly late to the party. It was originally used for medical purposes by ophthalmologists to correct sort of lazy eyes by injecting it into the eye muscles. But yes, it's a ophthalmological and neurological. It's called a neurotoxin because it's used to block those nerve signals. But it started as a method to manage neurological and ophthalmological conditions. So that's a very effective treatment. It can only be used in small areas. So like if it's because you can't inject all over the body because it's too, so there's a limit of how much of that toxin you can use in the body.
Injecting a neurotoxin into yourself willy-nilly doesn't sound like a smart life management skill.
If you did the whole thing, that would be really bad. But if you do it in localized areas, it's super effective, or it can be effective, I should say. And it's usually pretty easy to tolerate to the side effects. So that's another treatment option. There are some procedures where I talked about the gland. I skipped the gland. I'm going to come back to the gland. There are procedures that destroy the gland. So they used to do, and maybe they still do, but only very limited surgical procedure where they cut out the tissue that holds the glands. They literally do an operation, slice it out, and just got rid of it. I see people who've had that done before. Usually, patients who've been much further into the course of their condition. They're usually older, but it's quite significant as you're left with a decent scar and the post-surgical problems that can relate to that. There's there are more modern techniques to destroy the glands using microwave technology and some laser technologies, which are sort of emerging. So they're still pretty full on because you are like literally cooking your tissues. The sweat glands got water in them and therefore they can heat up and you're going to thermoablate them. That would be the term. But yeah, that's another way you can deal with sweat glands. Again, you can only do that in very limited areas. Like you're not going to go and thermoablate your facial sweat glands or chop out your facial sweat glands. Underarms certainly would be something you might do that. But yeah, there's some targets, but it's not for everywhere. And you've got to sort of tailor the treatment to the person, where they're sweating, how much they're sweating, what their other medical conditions are. So they're the mainstays of treatment and the various targets.
Obviously, the idea of removing entire sections of our body, whether it's the sections that hold the sweat glands or things like that, or thermoablating, as we say, that's quite invasive compared to tablets or even just a single or a couple of Botox injections. How much difference is there? When you see a patient or treat a patient, for instance, how long can it take?
You mean how long can it take to get on top of their condition?
To literally give them a Botox injection that makes a difference. So how long does it take for that to in your clinic if they happen to be there?
So like those procedures, like botulinum toxin procedures, are quite quick. You've got to, depending on the area and how many injections you have to give, they're quite speedy. It doesn't take particularly long. Depends on the patient as well, because it's unpleasant to have needles jabbed into you. But that can be very quick. If you have a minute, it's that's a very efficient process.
And how quickly does it take effect?
Usually 1 or 2 weeks would be sort of standard. Some people say that they notice the effects the very next day, and other people say, maybe 2 weeks, maybe a bit longer. And that probably depends on exactly the makeup of that, the junction between the nerve and the gland, because it's a protein chemical that goes in and binds into or joins into the junction and then sort of cleaves it. So that, like, if your protein structures are slightly different, then that thing might have a bit more trouble finding its way in there and separating it versus someone who might have like a perfect match, for example. So yeah, it does vary, but yeah, that's sort of a few days to a couple of weeks would be standard.
And then how long does the effect last for?
Again, that varies a lot. It's mostly about 3.5, 4 months would be sort of standard. And then some people go for longer, 6 months or even longer than that. And in general, like in muscle, which is why I mentioned it, sort of started as a treatment to try to disconnect nerve from muscle. The research, they sort of done experiments where they've injected it and then looked at over time the regrowth of the neuromuscular junction. And that's typically around 3 months on average. Sweating seems to be a bit longer. You seems to last a bit longer. And I'm not sure whether that's specific to how it reconnects or whether it's because there's more factors that we've already talked about in sweating. So when you haven't sweated for a handful of months because your nerves are disconnected, then your brain's is not thinking about it. And so then it might take a while to sort of realize, oh, hang on, I'm sweating again. And then those brain processes that can make it worse may take a while to kick in as well. But I'm not entirely sure, but that seems to be an observation between treating a muscle problem and treating a sweat problem.
Think about this as perhaps a bit of a modern issue in that identifying that this is a medical condition, not just some people happen to sweat more than others, and there's a reason, neurologically understanding the way that that works. What are some of the big steps that have been taken research-wise in since you've been working in this that have perhaps made a difference when it comes to both the understanding of and treatment of the condition?
Yeah, so it's something that I guess we've had a fairly good understanding of that physiology that I mentioned. A lot of that's a neurophysiology of neuroanatomy, neurophysiology has been well established. So that's been known about, and we've known sort of why or the mechanism for sweat production and the like. As you mentioned, I think that partly it's sort of the recognition of it as an important thing, which has been a more recent phenomenon. So that's probably what I've, that the awareness, people appreciating that it's the proper thing, that it's not something that's not nothing, something to be swept under the carpet or don't worry about it. It's, I think that reflects other changes in mindset in healthcare, validating conditions that affect people substantially, even if it may be something that you can't see. For example, migraines are a great example of that. It's a condition that it's really horrible for people who have them, but you can't see it. You can't measure it. And so people are like, oh, it's just a headache. No, it's not. It's really a debilitating condition. So I think it's probably that same phenomenon where we're going, okay, these are all important things. These are people who are suffering. Sure, maybe sweating to someone's not it doesn't bother them, but for all these other people, it does. And that's been probably the main change that I've seen. Is that sort of validation of it as a proper issue and awareness of it.
Yeah, I
In
don't
terms
wish
of
sorry, I don't want to conflate the issues, but speaking to somebody recently about menopause and perimenopause and the understanding thereof, and the fact that it's no longer being just swept under the carpet and just deal with it, move on. The fact that there is an impact that is not just physical, but is psychological or is emotional. There is that societal awareness that grows, I suppose.
Yeah, it's another good example of an apparently sort of silent condition. You can't sort of see it, but it's affecting a lot of people, and increasingly the awareness is increasing that it's a condition that needs proper attention. So in terms of sort of like the science, I mentioned some of that product development in terms of treating hyperhidrosis. So that's probably where, like now we say it's a proper condition and we need to have proper treatments for it, and a variety of treatments, some options available, because not everything works for every single person, or they may not be able to tolerate it, or you might not tolerate the topical treatments, and you might say, oh, I couldn't bear to have needles jabbed into me. Okay, all right, well, we need to come up with something else. Or, the pills, you might be able to handle them because you're on other medications. So maybe the localized treatment is better for you. So I think having some options available is great. And that's probably, that's something that seems to be moving in at the moment. And yeah.
In terms of questions that perhaps are unanswered at the moment, what are some of the big ones that you'd like to see answered, or perhaps are confident may be answered in the next 5 years or so? Some of the main ones that would be good to know.
Well, look, I'm a neurologist, and I sort of am interested in all those unusual workings of the brain. So I already mentioned some of these strange things which I don't fully understand. Just for academic sake, I'd love to understand how the brain works a bit better. And there's a few specific phenomena in hyperhidrosis that, might illuminate that. And the brain is the sort of the final frontier of medicine. So perhaps not directly related to hyperhidrosis, but related to my career more broadly. Like, it'd be wonderful to understand the brain a bit better. And I think if we understand the brain a bit better, then we might be able to understand why when you think about sweating, your hands start sweating. So maybe that's a good start. I'm not sure about 5 years though. That might be something that outruns me. But
I check back with you in 5 years and see. Finally, I'd like to finish off something. When we first spoke, you mentioned to me, and I mentioned this as the florist, the idea of somebody bringing joy. What is the reaction like if somebody has, say they're 50, 55, they've been a person who sweats a lot their whole life, perhaps having to change clothes at work, unable to do certain things, and with a few injections you can magically make that change? What's their reaction like?
That's a good scenario, because we very often see people who have had it for decades, and they come in and they go, oh, I didn't know there was a treatment for this, which is strange. You think, wow, you've suffered with this all this time. Or I wish I had this treatment when I was at school, because I used to, it's clearly impacted their life so much. But, the thing that, again, I find this a little bit strange, but spontaneously people come in and say, oh, that was life-changing. That's the term they use, life-changing, which, it's as though we're sort of giving them a promo flyer on the way in and, we want to use it for our next,
Check around for the cameras filming the
exactly.
advertisement.
And like, oh, can you just say that again? We don't do any of that, but that's what they say. It's life-changing. So, and they're quite sincere about it. And so something that's, again, for people to say, oh, it's not an important problem. Like, not important problems, fixing a non-important problem doesn't make someone think it's life-changing. But these people are genuinely, their life is revolutionized with treatment, whatever that might be. So, yeah, that's probably the most common description. But in general, everyone's very, very happy with it. And it really lightens if you don't have to worry about that, we've got too many other things to stress out about. And if you don't have to stress out about sweating too much, then you can focus on One Nation or Donald Trump or whatever else you want to do,
Yeah, let's not set our sights too high for the things we should worry about. Either way, try not to sweat the small stuff. And if you do have a problem with sweating itself, you can probably think about that as well. Doctor, Professor Neil Simon, all of the above, thank you very much for your time today.
Pleasure. Thank you.
So around 1 million Australians means it isn't a small problem. But as we heard there from Professor Simon, it can often have a relatively simple treatment for at least a period of time, which is more than we can say about other debilitating health issues. A big thanks there to the incredibly busy but generous Professor Neil Simon. On our website, you can find links to his research, as well as his Sweat Clinics Australia, and of course, a transcript of this episode. Obviously, if you're someone who thinks they may benefit from treatment, you should speak to a GP. We're not a doctor, obviously. Those GPs can refer you to someone they recommend for the condition. Thanks for listening. I'm David Curnow. Goodbye.